Hello, today we're going to talk about ataxia. Ataxia is a problem with coordination in the cerebellum. Patients with ataxic movements will have problems controlling their trunk, upper extremities, and lower extremities. Ataxia movements are uncoordinated and very uncontrolled jumpy movements. The best treatment for ataxic movements is joint approximation, which can be attained through increasing proprioception. Increasing proprioception can be done through the use of TheraBand or weight-bearing exercises. First, we're going to go ahead and take a look at how to apply TheraBand to the lower extremities. Apply the TheraBand to the lower extremities. The first thing you're going to do is to make sure that there's a gait belt on the patient's waist. To ensure that the patient has as much proprioception as possible, we want to make sure that there is enough tension in the TheraBand. In order to do so, we want to make sure that there is ankle, knee, and hip flexion before applying the TheraBand. Next, you will take a long piece of TheraBand. You're going to put it underneath the patient's foot, cross it in front of the ankle, behind the knee, and then again in front of the hip, where you will secure it at the gait belt that you had applied to the patient's waist. You will make sure to do this to both lower extremities. Now that we have TheraBand attached to both of our patient's lower extremities, I'm going to ask my patient to come into standing where we will be doing the remainder of our treatment. Now that the patient is in standing, they may have a greater sense of where their limbs are. Today, for the remainder of our treatment, we're going to go ahead and do box steps. This is a great exercise because it translates over into gait, and having the TheraBand on will allow the patient to have a greater sense of where her legs are going to reach the target. So go ahead and use your left leg and tap the box. Great. Repeat that again. And while this leg is reaching for the box, the other side is getting a closed chain exercise. It is important to remember to do this exercise bilaterally. Go ahead and switch. To apply the TheraBand for an ataxic trunk, you're going to first take a long gait belt. You're going to put it in a loop and then form a figure 8 with the gait belt. You're going to place it around the patient's legs, and they will shimmy it up as if they were pants. Next, you will take long pieces of TheraBand. You will tie the TheraBand in front of the gait belt on each side. From here, you will take the TheraBand and you will go over your patient's shoulders, and you will cross the TheraBand in the back as if it were suspenders. Because you want the most amount of tension for the trunk ataxia, make sure that you pull tight on the TheraBand before tying it on the gait belt behind the patient. Now that we have the TheraBand applied for trunk ataxia, we're going to have the patient perform sitting exercises. Today, my patient's going to be performing dynamic sitting balance while utilizing PNF patterns. So I'm going to have her take the rings and place them on the IV pole as such. To ensure that the patient is really doing dynamic sitting, it is important to make sure that the objects are at least 10 inches outside of the base. So now that we've done the D1 PNF pattern, my patient is now performing D2. When applying the TheraBand to the upper extremities, again, we want to create as much proprioception within the joints as possible. To do so, you will pull the patient into wrist, elbow, and shoulder flexion. To increase comfort in the patient, it's important to pad the TheraBand before placing it into the patient's palm. Go ahead and hold this for me, please. Great. Next, you will cross the TheraBand in front of the patient's wrist. Behind the patient's elbow. And in front of the patient's shoulder. Again, with enough tension to increase the amount of proprioception. Once you have tied the TheraBand at the patient's shoulder, you will cross the TheraBand behind the patient and tie it on the contralateral side of their pelvis. Now that the TheraBand is applied to the patient for their upper extremity ataxia, you can perform dynamic reaching exercises as seen in the trunk ataxia video. Be sure to make sure that the patient is reaching at least 10 inches outside of their base of support to be getting the most dynamic exercise possible. We want our activities to be as functional as possible. Thus, it's important to remember foot placement should replicate tasks such as gait. Lateral weight shifts are not functional, so we must choose more advantageous positions for our feet. A staggered stance is optimal as it translates into gait. Patients who are at high risk of falls can start from a wider base of support and work towards a more narrow base of support. Once a patient has mastered static standing balance, they can progress to dynamic stepping patterns. Here, the patient is demonstrating a staggered stance with a wide base of support.